Morning, everyone. I know it's Sunday morning, so a few of our colleagues may be coming in and as the session progresses, but those of you who are here, welcome to this last plenary of the conference. Our host country, South Africa, has bravely faced many challenges, and it is also known as a land of hope. How appropriate, then, that we devote this last plenary to one challenge that has always been significant for the health community, but that now shows signs of hope and opportunity. There is no more critical issue facing the public health than the need to have sustainable funding. Our future success depends on it. We must explore and develop all potential strategies and mechanisms to achieve it. Now, new forms of sustainable funding will be powerful tools to support areas of public health that are not funded well. This includes communicable and non-communicable diseases. Two current approaches are the focus of this session. One is gaining increased acceptance and implementation, tobacco taxation. The second is still emergent, and very promising, health promotion funds. Both provide hope and opportunity. Tobacco is the only product that kills half its regular users, the single greatest cause of preventable death in the world. The WHO Framework Convention on Tobacco Control, the FCTC, identifies tobacco tax increases as the most effective means to reduce tobacco use, one of the core strategies. Not only to directly reduce usage, but also as a revenue source for tobacco control programs, and potentially to address other non-communicable disease issues. Recently, there has been interest in applying similar taxation strategies to other products that compromise health, like alcohol, unhealthy foods and drinks, to reduce the harms that they cause. This will also create sustainable funding sources to meet under-resourced public health needs. One emerging avenue for this is health promotion funds, or HPFs. These are mechanisms funded by tax reforms to channel funds towards specific public health programs. Tax reform can help even the poorest countries carry out the FCTC strategies. But these opportunities inevitably come with challenges. You will hear soon the complexities of creating new, unprecedented structures like HPFs under the close scrutiny of Parliament, the media, civil society, and other stakeholders. South Africa, India, Philippines, and Vietnam are countries that have demonstrated innovation, determination, leadership, in pioneering these new areas. And you will hear from our speakers very soon about the roadblocks and difficulties that they experience in creating the HPFs, or in some cases are still working to overcome them. But now let me introduce our moderator. Dr. Joseph Saluji is the Executive Director of South Africa's National Council Against Smoking. He is a committed capacity builder and advocate. He received the Luther Terry Award in 2012. This is the international recognition for outstanding leadership in tobacco control. Dr. Saluji.
Thank you very much, Jose. Good morning, everybody. Sanibonani Dumela. Today is the last day of the conference, and I hope that many of you have looked at our mountain. The mountain wears many, many different faces. And let me just tell you a local legend about the mountain. The other day you may have seen it was misty and cloudy. Occasionally in summer, clouds sit on the top of the mountain, and Cape Townians call this putting a tablecloth on the mountain. Now, the technical explanation for that is that the southeasterly winds blow the clouds on the mountain. But there's another local legend about the mountain. And the local legend has it that in the 1700s, a Dutch pirate by the name of Jan van Hanks gave up his swashbuckling ways and came to settle in Cape Town. Now, Van Hanks was an avid pipe smoker, but his wife wouldn't allow him to smoke in the house. His wife was probably one of the first anti-smoking advocates in South Africa. And I don't know if there was a non-smokers' rights movement, but I'm sure she would have belonged to it. Anyway, she wouldn't allow him to smoke in the house, so he would go out into the mountains between Devil's Peak and Table Mountain and sit there and smoke. And one day while he was smoking, a stranger approached him. And the stranger also said how much he liked cigar smoking and sat down and started to talk. And soon the talking became bragging about who was the better smoker. The stranger, as it happens, was the devil. And Van Hanks and the devil then decided to have a competition about who could smoke the most. And so for days upon end, the two of them sat there puffing on their cigarettes, and the smoke from, their cigars, their pipes. And the smoke from their pipes soon covered the mountain. And that's where the clouds that come over Table Mountain comes from. It's Van Hank sitting at the foothills of the mountain smoking his pipe. We are privileged today to have a very distinguished panel of people. And before I introduce them, let me just say a couple of more words. The first is this conference certainly has been dominated by the idea of eradicating TB. And we must get the message through that tobacco control is part of TB control. That people with TB are much more likely to become infected, to have recurrent TB after they've been cured, and to die. 1 in 5 people who dies from TB, it's because of smoking. They're much more likely to die from smoking. So we need to include the two. And tobacco control from a TB perspective is not just helping people to stop smoking. It's also about changing the environment in which people make decisions about their smoking habits. So it's more than just smoking cessation in our clinics. Earlier this year in Addis, the Financing for Development Conference of the United Nations met, and governments adopted a resolution which said that they must increase tobacco taxes and use the money to pay for sustainable development programs designed to fight poverty and hunger. This session is about taxing bad for good. To use the taxes from tobacco, and not just tobacco, but other products as well, and how can we use it to promote health? There are various examples from around the world that have various countries that have already adopted this legislation, and we'll hear more about it. It's a particular challenge. It's a challenge we are trying to address in South Africa, but I'm delighted to see that we have people here who've achieved it, and I'd love to learn from their experiences. Let me introduce our panel. We have with us Minister Kaul Singh Thakur, who's the Minister of Health and Family Welfare, Law and Revenue in the government of Himachal Pradesh. He was elected to the state legislature in 1977, I believe, and has been re-elected 8 times. In looking at your profile, I was interested. You call yourself a politician, an advocate, and a horticulturalist. That appeals to the green side of me. Our next speaker is Mr. Jeremiah Spall, right at the other end, who's the Undersecretary at the Department of Finance, Government, and in the Republic of the Philippines. He served as the acting executive director of the World Bank Group in Washington, D.C. in 2005 and 2006. He's also an internationally recognized expert in corporate governance and energy and water sector reforms, and he's recently been involved in reforming the alcohol and tax policies in the Philippines. And then, replacing Professor Q from Vietnam, we have Ms. Anne Jones. Anne, I've known you for a very, very long time. Some of you will remember she was the CEO of Action and Smoking in Health in Australia and received the Order of Australia for her work in reducing tobacco consumption in Australia. She is currently the technical advisor for the Union and the focal point for Vietnam. Thank you very much, everybody, for joining us this morning. For those of you who've skipped church to be here, you'll be happy to hear that we're talking of sin taxes, so you won't be too far away from being preached at. Okay. Let me begin with Minister Thacker. You've done some great work in Himachal Pradesh since you became the Minister of Health and Family Welfare. And you've had some successful programs. But what I'd like to ask you is, what are your challenges in financing tobacco control activities in your state?
First of all, thank you to the Union for inviting me for this conference. And I congratulate all the delegates for these successful events. I am from Himachal Pradesh of India, one of the hilly states. Population is about 7 million only, but area is quite long. This is a hilly state, and capital is Shimla, which used to be the capital of British rule before independence, and they have given the name of Queen of Hills to Shimla, which is very famous place. And Himachal is one of the world's best tourist destination. So I request you, whenever you find time to visit India, please don't forget to come to Himachal Pradesh to see the beauty, greenery and scenery of Himachal Pradesh. As you know, many historical agreements were signed at Shimla before independence, when British rule was there, and after independence also. So for Himachal Pradesh is concerned for the control of tobacco, it was not on the priority list. I also remained health minister from 85 to 90. At that time, the top priority was given to the small family, that is a family planning, control of tuberculosis, control of blindness, etc., etc. But now, from the last 5 years, we have given priority now to the control of tobacco, and I am happy to inform this gathering that Shimla is the first city in the country which was declared smoke-free after conducting a survey by independent agencies. And thereafter, we started rigorous campaign, and then Himachal as a whole was declared as smoke-free state in public places in May 2013. Now Himachal Pradesh is a smoke-free in public places. Over the past 5 years, tobacco control has advanced in my state of Himachal Pradesh, and it has become close to my heart. So we have made some initial progress, and whole state of Himachal Pradesh, we are starting a sensitization campaign for the control of tobacco. But at state level, there were no budget provision provided for the control of tobacco in our state also, or in other states of the country, and even in India. Therefore, we worked in a constrained environment, and we would have done much more if sustainable funds were available to the states. So, there is definitely financial constraints to sustain tobacco control in our state. But we are trying our best to impose fines to the violators of COTPA. When any person is found smoking in a public place, he is immediately challened and fine is recovered from him, and that money is spent for the control of tobacco in our state. So far, Himachal Pradesh till date, about $200,000 has been collected as a fine by enforcing the legislation COTPA. However, as on today, there is no earmarked budget for the control of tobacco or available to the state for this purpose. That is the biggest challenge before us. But anyhow, we are trying our best to propagate the control of tobacco in a big way in my state. Thank you.
Thank you very much, Minister. I certainly think it's a very novel idea, and I'd not heard of it before, is that to use the fines that are imposed on people for smoking in public places and then use them for tobacco control. So that certainly is something that we should think more about, and it's a novel suggestion. Under Secretary Paul, I have heard you describe the excise tax on alcohol and tobacco as primarily a health measure with economic implications. I think it's a lovely phrase, and I wish you would tell us more about what you mean by that exactly.
First of all, thank you for inviting the union for inviting me to this conference. It's really a privilege to be here. When we did the sin tax reform, particularly on tobacco, we essentially frame it as a health measure rather than a revenue measure. Why? Because if we package it as a revenue measure, the tax rate increase will not be that significant. What differentiates this from the previous tax increases is that we consider the WHO FCTC. We also consider that the tax rate should be significant enough in order to attain a health impact. So just to show you in the slides, if you have that, what are the winning numbers? We essentially generated $2.3 billion in incremental revenues for the first 2 years of implementation. And for the first 10 months of 2015, that's another $1 billion. We've increased funding for the Department of Health budget by 57.3% in 2014 and 63.2% in 2015 over 2013 levels. And what also significant is that the revenues enabled the national government to subsidize the health insurance premiums of 14.7 million per primary members. Together with their dependents, that's roughly 50% of the Philippine population. But since a picture paints 1,000 words, I'll show you some graphs. It's a win for fiscal health. If you look at the share of tobacco and alcohol taxation, it essentially, you see the declining trend. And after we passed the tax reform sin tax bill, we essentially went back to 0.9% of GDP in 2013, and we're expecting by 2016 it's about 1.1% of GDP. It's a win for public health. You see also the increasing trend of our budget for the Department of Health. It's also a win for the poor. If you see the lower right-hand side, you see the skyrocket increase also of the amounts that is spent for the poor for health insurance premiums. But what's also a kicker here is that it's a win for fiscal and public health. You see the line going up. Well, who says you can't have your cake and eat it too? So you have increased revenues, but at the same time, decline in removals or consumption. In terms of, it's also a win for tobacco control and prevention because we've essentially reduced the prevalence for the first time below 30%. And that's really an important consideration. So tobacco reform is not easy, but to give you a context, we only won by 1 vote in the Senate. So it's a battle, it's a war, but if there are committed people, a whole of government and whole of society approach, nothing is impossible. Thank you.
Thank you very much. And I think what the Philippines experience is a universal experience. When you increase tobacco taxes, consumption goes down, the numbers of people who smoke go down, and most importantly, fewer young people start smoking. And the other thing is government revenues go up. So your experiences are the same experiences we've had in South Africa and the same experiences they've had even in the rich countries of the world. It's a universal experience. And you've had a similar experience in Vietnam, where you've helped set up the Tobacco Control Fund. How did the Tobacco Control Fund in Vietnam come about? Who were its champions? And what were the most effective arguments and the lessons you learned in Vietnam?
Well, that's a very long question, but just to put it in context, Vietnam is one of about 30 countries now that have established sustainable funding mechanisms. And I think the simple answer is really, if you apply the union values of know, share and act, that is simply the way you do it. That's what happened in Vietnam. We knew that we had the evidence that overall tobacco taxes are very low, that also health funding is extremely low and is not enough to reach not only national health goals but also global health goals. And we know that the tobacco industry is working very hard to undermine the progress that is being made in countries. They're undermining attempts to reform tobacco taxes and tobacco control strategies as well. So that's what we know. In terms of sharing, there's been a lot of sharing by partners, and particularly the union. We've developed a number of resources, toolkits, trainings, sustainable funding mechanism is something we've been working on in recent years, and we shared a lot of these good resources and technical advice, study tools, all sorts of grants to help Vietnam and also other countries. So the sharing is a critical part of helping a country resolve its problem with low funding for health programs, and action is taking place in a number of countries through grants, through again the advice of technical people, of experts in tax, experts in tobacco control, and all of those things together really add up to a success story in Vietnam, and of course not least of all our Vietnamese colleagues who in the Ministry of Health in particular have been driving the change and working with the Ministry of Finance, which many describe as those two ministries, one's like Mars and one's like Venus, and to bring the two together is not always easy, and that has been progressed, I think, very well in Vietnam. So it's a collaborative effort, it's multi-sectoral, it's bringing all those elements together.
Thank you, Anne. And of course, you've written a booklet which is available through the union for people who want to set up health promotion foundations using taxes.
Yes, we have the union has a discussion paper which is online, and they've also got a training which will be trialling next month in Bangladesh. So there'll be a toolkit as well that will come out of that. So keep an eye on the union website, and I'm sure there'll be more countries. 30 sounds like a lot that have sustainable funding mechanisms, but given the low level of funding for health, and it's not just health for tobacco control, it can be health for whatever the health data shows are the leading causes of death and disease. So we hope these resources will be really used by far more than 30 countries.
Thank you very much. Minister Tucker, Anne said that having finance and health is like Venus and Mars. Now, you're in the very lucky position of being both Minister of Health and Minister of Finance. So do you wake up in the morning and the two sides of you argue with each other? Yeah. But the question to you is, in India, excise taxes are set by the central government. And the local states only have the power to levy VAT. What is the VAT in your state, and how are you using these taxes for supporting tobacco control and other health promotion activities?
In fact, when I became health minister, I visited National State Cancer Hospital, and I talked with the patients, and I found that 70% patients of cancer were because of tobacco, either smoking or chewing of tobacco, gutka, canny. So we decided that we should give now top priority to the control of tobacco in our state. So I requested the Chief Minister, who is a Finance Minister. I am a Revenue Minister dealing with the land records, and Finance Minister dealing with the finance, imposing of taxes, etc. I requested him that we should enhance the tax on tobacco. And I am happy to inform this gathering that as a part of tobacco control measures, we doubled the value-added tax on tobacco from 18% to 36%. That was one of the measures. Of course, there was a lot of pressure and pressure tactics used by the tobacco industry to reduce or to roll back the taxes, but we did not yield, and we did not roll down the taxes. That is one. But unfortunately, the taxes which we enhanced, value-added tax, but any part of that tax is not used for the control of tobacco. That is unfortunate part. I have requested the Chief Minister, who is the Finance Minister also, that at least in next budget, there must be some announcement that some fund, some percentage of that should be spent for the control of tobacco in Himachal Pradesh. As I told earlier, Himachal is a hilly state, and at Shimla even the temperature is about 5 degrees Celsius, and in some part which is adjoining China, the temperature is -2 to 5 point. So people generally think that if we smoke cigarettes, perhaps we will be warmed up. But that is not, that is scientifically it is not correct. So we have started a sensitization campaign in the state, and I have requested the Chief Minister, even Government of India or any state, we have 29 states in the country, no state earmarked funds from the budget allocation for the control of tobacco. Now I have requested Government of India also, Ministry of Health, that some funds must be earmarked for the control of tobacco, because it creates many problems that we are discussing, lung disease here also, tuberculosis also. Many persons, they are suffering because of tuberculosis, because of smoking, and lungs cancer because of smoking. So it is our endeavor that we must find some solution to this problem. Even the Government of India has proposed that some companies, they should earmark 2% of their profits for health sector, for control of tobacco. So I think, but there is a challenge also. We should not involve tobacco industry for this purpose. Otherwise, they are influential person. They try to influence. When I, banned sale of single cigarette in Himachal Pradesh, there was a lot of pressure on me. There was a lot of pressure on the Chief Minister to withdraw this notification, because I am of the firm view that students start smoking from purchasing one cigarette. And there is no warning in the single cigarette. Of course, there is a warning, cigarettes kill, smoking kills, but there is no such warning on a single cigarette. So even if the High Court has also, the High Court of Uttarakhand has also taken a stand that since there is no warning on the single cigarette. So the ban of sale of single cigarette is legally allowed. So similarly, 2% of the profit of corporate social responsibility is to be used for this purpose. While this provides for a huge opportunity, it also poses immense challenge, as it does not rule out tobacco companies' interference from propagating their cause in the name of corporate social responsibility. The conflict of interest needs to be addressed, and more importantly, it is vital that we get companies, but not tobacco industry, to support tobacco control as well. So I think in future, we have taken sensitization to the Gram Panchayat level, which is an elected body. Our Gram Panchayat consists of 5,000 to 7,000 people. They are elected body, and every Gram Panchayat of our state has passed a resolution that will start the cessation of cigarette smoking, and I hope that within the next few years, we would be able to control this menace.
Thank you. Just one thing, and I'm not sure I understood clearly. Certainly the idea, and maybe the other panelists will also comment on this, certainly the idea of excluding the tobacco industry from corporate social responsibility programs is a good one. And several governments have done it, including, as far as I know, Mauritius. They don't allow the industry to have corporate social responsibility programs because all they are is window dressing. They're trying to put a patch on a major problem and make themselves out to be respectable companies. But there is the other issue, and that is the polluter pays issue. The tobacco industry is responsible for the problems caused by tobacco, and similarly the alcohol industry. We're not just talking tobacco, but we're talking all bad, harmful products. The alcohol industry is also responsible, and they should pay the costs of the societal costs of remedying that. Perhaps, Anne, you might want to comment on that?
Well, I think I think that's right, that the tobacco industry does impose enormous costs on a government and on businesses and individuals. I mean, putting aside even the deaths and the suffering from diseases, there are a lot of studies that look at direct and indirect costs. And I know in Vietnam, just for 5 diseases alone, the cost is over $1 billion. And I think I think there's an important point that was made here about if you want to try and increase health funding because it's underfunded, you have to make the case for why and how. And I think we have so much evidence about what tobacco is costing us in terms of deaths and disease, but also lost productivity and healthcare costs. So it's really long overdue, I think, for more governments to address the problem. But they do need expert, I think, advice and support from civil society, and international groups have really been helping to say this is how you make the case in your country, and this is how we recover those externalities, which are all the costs associated, as well as use that money to reduce the consumption in the future.
Under Secretary Paul, you might want to comment on that as well, but let me also just ask you another question. You said that the fund in Philippines only got through by 1 vote. Now, intuitively, it makes a lot of sense. Tax harm, by taxing harm, you reduce its use, but also use the money for good purposes. And I would have imagined that's an easy sell, but unfortunately, there's strong political opposition. And one of the things that they do, one of the reasons people oppose such levies is this idea of earmarking. Perhaps you can explain what earmarking is and how you overcame that problem in the Philippines.
First of all, I'd like to stress that the tobacco industry and even the alcohol industry are really politically connected. So it's very difficult to tax them in a substantial way. But as I said, in our case, we did it because we frame it as a health issue. the tobacco industry has a playbook, and they would always state two things. One, they're against earmarking, and the other one, they will say that the tobacco taxation is regressive. But when you're looking at the fiscal policy, you're looking at the revenue side and the expenditure side. It's like the scissors. So while from an economic standpoint, from a purely theoretical economic standpoint, one would argue that tobacco taxation is regressive. But if you look at it from the fiscal policy in totality, wherein you transfer the revenues from tobacco taxation and put it for universal health care, for example, that will really impact the poor, because the benefits, the contribution that they give to for taxation versus the benefit they get from universal healthcare is much more. So the return is much more. And in the case of earmarking, it's also something that they're against, because again, from a fiscal policy standpoint, you want flexibility, and normally the finance ministries are for a one-fund concept, and earmarking essentially reduces their flexibility. And the argument is, if it's important, then the health ministry should provide a budget for it. But the reality is that you have a limited budget. And in our case, we essentially, while we were originally against earmarking, but the political realities is that the only way you can pass it is to link essentially the tax to where the benefit will go. And I think a lot of people are thinking that way right now, that if you link the tax increase to a benefit, then you'd be able to sell it more. And in our case, it's a soft earmarking, which means that while they are assured of funding for health, they have to go through the strict budget process, in the sense that they have to have a concrete program, they have to have a medium-term expenditure program, they need to pass the efficiency effectiveness test. So they're assured of funding, but again, you still have to come up with a concrete program. So it's not a blank check, but at the same time, you're assured of funding. So it's really up to the health ministry now to come up with their concrete programs for health promotion, for tobacco control, and other health measures.
Thank you. The models we've heard so far are the government taxing tobacco, and in some cases alcohol as well, but then giving the money back to other government departments. The money is earmarked. That means it has to be used specifically for programs that have been decided. But this is not the model that's used in all countries. Other countries have used different models. So certainly Australia, which had the first health promotion foundation in the world, used the money not just for tobacco control activities, but for a whole range of activities. And I know in Thailand, where there's a health promotions foundation, they use the money for the tobacco control program, the alcohol program, for road accidents, and they've been running them long enough to show decreases in all of those problems with the utilization of funds. So there are various models. The model of taxing bad is good, and in fact, it's not always just taxing bad. In Zimbabwe, they impose a tax on all companies, an income tax of 3%, and use the money to provide antiretroviral treatment for people with HIV/AIDS. So there's various models, and there's not one size fits all. I think that's your phrase. Minister Thacker, we're going to soon wrap up, and I was hoping to open it to questions from the audience. So it's a very quick round. How optimistic are you that you'll get the government of India to support tobacco control programs and other programs in your state?
Thanks, Mr. Yusuf. I think the sustainable funding is very important, and we need to explore various possibilities to achieve it. I have requested Ministry of Health, Government of India, to earmark some specific funds for the control of tobacco, because it is creating a lot of problems in the health sector. So let us hope, and I hope that Government of India will respond positively. So we have to learn from early successes from other sectors, like development of vaccines and this climate change, which have started efforts on sustainable financing. This, however, cannot happen if there is no co-investment from the government itself. Co-investment is important. Even small doses of funding from sub-national governments provide boost for donors and for the local government officials because it demonstrates the strong intent and commitment of the policy makers. So we should have a political will to do it, and I hope that the Government of India will come to the help on this direction. Second, I think there is a big opportunity for us to get responsible investors, private foundation and donors together and getting their commitment towards tobacco control. To do this, there's a need for grant vision. I hope that if we take this in a prospective manner, we would be able to get quite financial help for this program. So I propose the Union should consider doing a call to action to end tobacco use in the coming years. Of course, Union is doing commendable job on this front, and I hope that with the efforts of Union and with the cooperation of countries, we would be able to achieve this goal. Third, I propose that tobacco controls need a structured response, not a fractured response. We have evidence like Empower package and FCTC guidelines to take us through milestones. We must remember that to treat tobacco use as an malady, perhaps even a disease, like any disease, tobacco control cannot advance in isolation. To this effect, the Government of India has proposed the National Tobacco Control Program in the country, and in that will control tobacco in a systematic fashion. I think that all countries should develop their National Tobacco Control Program to ensure sustainable funding from government's regular budget. Fourth, I propose that there is also a big opportunity to create health promotion funds, as you have just mentioned. This is also very important at national and state level to ensure that tobacco control gets matching fund without any interruptions. I think this would be a better way in control of tobacco. There is a need for a strong political will, commitment of the government, development agencies, and donors to work to ensure long-term sustainable financing for tobacco control in developing countries and globally, but this needs to be without any interest of any party having any interest in tobacco industry. I am happy to inform you that we had one tobacco industry in Himachal Pradesh, and we took up this, when I was in opposition, I took up this matter strongly in the floor of the Vidhan Sabha, opposed the establishment of tobacco industry in Himachal Pradesh, and we compelled the government, which was BJP government at that time in Himachal Pradesh, and that industry was closed. But there was hue and cry. Hue and cry from the women who were working in that industry. So we gave them employment in developmental works, and they were happy. So Himachal Pradesh is taking all necessary steps in this direction, and I assure the gathering that will not lag behind in the control of tobacco in the near future. Similarly, there can be no fence sitting or staying neutral on this issue. We want total commitment from all those who save lives and want to see the end game of tobacco during their lifetime. Fortunately, I never smoked, nor I will smoke in future. That assurance I can give you. That's why I am the champion of control of tobacco in my state, and I am requesting the Finance Ministry, I requested the Government of India, Ministry of Health, to earmark special funds for this purpose. Thank you very much.
One of the things, I'd like to highlight an issue because for those of you that have a lot of tobacco farmers, that's an issue that's normally raised. What will happen to the tobacco farmers? In the case of the Philippines, we essentially, apart from the bulk of the incremental revenues goes to universal health care, we also made sure that there will be social safety nets for the tobacco farmers. When we've allocated 15% of that for tobacco farmers in order for them to shift to other crops. So in a political setting, you really need to know, they will ask, what's in it for me? And even for the tobacco farmers, even for those that would be, quote unquote, allegedly be affected by the tobacco tax increase, there are social safety nets. So I think a lot of countries in Africa have tobacco plantations. So you can certainly do a version of the Philippines by helping them shift to other crops.
Yeah, and in fact, that's part of the Framework Convention, is moving tobacco farmers into alternative livelihoods. We'll have a few minutes for questions, and so if people do want to ask questions, there are loudspeakers. Please come up to that. And while you're doing so, let me just ask Anne one final question, and then maybe we'll just have time for a wrap-up from each of you. But we've been talking mainly tobacco. But of course, this is not just about tobacco. What are the lessons from tobacco control for non-communicable diseases?
Look, there's a great lesson from tobacco control, and that is that we can tax unhealthy products and gain the benefits of not only using the increased price to drive down consumption, but to use part of that revenue to pay for a sustainable funding mechanism. And that's not some just sort of magical thing that sits out there. It involves having national strategies, health strategies, infrastructure, particularly monitoring and evaluation. Really important, because if these foundations or funds, whatever that you want to call it, if they don't show that they're effective, their money may be, diverted somewhere else. So that's a very important part of the advice we give, is to set up a good evaluation plan for how the money is being spent, what sort of results are they getting, and what should they move on to next, because really the health data now is improving all the time in countries, and you've got to use the health data to say what are the biggest threats. It may not be tobacco, it might be TB. It might be mental health. And so if you've got a good structure in place and a good plan, you can then use the money for the programs that are really driving death and disease in the country that you're working in.
Thank you, Anne. I see somebody at the back there. Please introduce yourself and then ask your question. Oh, is that the cameraman? Sorry, I can't see.
Elif.
Here is one who is not a cameraman. Hi, good morning. Syntax is like a fairy tale to us as NGO. It is so fantastic. But, we have to be skeptic as an NGO community. How can we secure that this tax can be used in an effective way by the government? Is there a contribution on overseeing by the NGO community so that it can be used for very effective purposes? Or can we have targets such as reduction of tobacco consumption like 5 or 10% by this year, so that we know that it is used for good purposes? Is there a way of securing this?
Let me give you the Vietnam example, but there are many others. And of course, civil society is involved. It's not just government. They do work together, and it's not just the Ministry of Health, it's a number of ministries and health departments. And in fact, in Vietnam, they have set up a number of various groups to take charge, to be the focal point for research and evaluation and cessation and so on. And so through their grants program, they are reaching out to their 60-plus provinces, which involve their mass organisations, they call them, which are their unions of youth and women, as well as workers. And so through their networking, they are implementing their tobacco control strategies, which are then monitored and evaluated and all aimed at reaching health goals. So I think it's critical, of course, that it's a collaborative effort, and I think the civil society, which hasn't been huge in Vietnam but is growing a little bit, has been very important, and it varies. It's going to vary from country to country, but I think the lesson that we've learnt from not only Vietnam, but it's set out in the discussion paper, is that you use the tobacco tax and hopefully other taxes of unhealthy products to fund your strategic plans, to reach your health goals, and that you involve, it's a collaborative effort, and you evaluate it and you go back and ask for more, given that diseases are not going to, and deaths are not going to disappear overnight.
I'd like to add also that the civil society was really a critical component in our campaign for sin taxes. They were really an effective partner, and I'd like to thank again the union for supporting some of these civil society groups in the Philippines. They're not only involved in the passing of the legislation, they're also involved in ensuring that the promises for the sin tax are really implemented well. So we do have regular meetings with the civil society. And in the case of health promotion funds, apart from passing, increasing taxes on tobacco and alcohol, we've now have a law that, it's a bill that passed the Ways and Means Committee of Congress, wherein all tax measures emanate. And it essentially proposes an increase in taxes for sugar-sweetened beverages. And that was really packaged because we're now in the midst of restructuring income tax and income taxes. And we said that we will only consider income tax reductions if there's a compensating measure. And Congress essentially came up with this proposal to tax sugar-sweetened beverages, and that was essentially pushed also by civil society.
Please do.
Yes, it's a very important, relevant question we have put. I think the NGOs and civil society has to play an important role for the control of tobacco. In Himachal Pradesh, which was declared smoke-free, it is because of the role played by Himachal Pradesh Voluntary Health Association with the help of Bloomberg initiative that Himachal was declared smoke-free in public places. So if we put all together energy, we would be able to control this menace in future, and NGO has to play very important and dominant role in this direction. Thank you.
Thank you. We have another question.
Bartoli Petrosyan from Armenia. I have the following question. I would like to ask our speakers to comment on two options when there are sin taxes, whether they should go to a separate fund and monitored as a separate fund, or they should go and contribute to the national health budget, because each of them have their pros and cons. And I will give one example. If they stay as a separate fund, the bad thing is that it creates more fragmentation and sustainability might be under question. On the other hand, it might be easier to track how the money has been used. Thank you.
Thank you very much. Did you hear the question, everybody? Fine.
Yes,
Shall we
yes,
start with
sure.
Minister Thacker and then come round? Please do. Start?
Oh,
No, Minister.
Yes, there is a need for providing budget at the national level. And national level budget is given to the states, different provinces of country. We have 29 provinces. So we have requested Government of India, Ministry of Health, that they should approach the Finance Ministry, Government of India to allocate. I am happy to inform that Government of India has now earmarked specific funds, and they have taken 21 states for this purpose, National Controlled Tobacco Program. Now Himachal has also been included, and we hope that in future we'll get sufficient funds from Government of India for control of tobacco.
Thank you. Anne?
Well, because we've run out of time, I'd just like to refer you to our discussion paper because there are many models. Those issues are addressed in the paper in terms of the different models that you may use in your context and the different infrastructures. But yes, you do have to, obviously, you're not taking over the role of the Ministry of Health. You are providing funding for its own separate strategic plan.
I think more important than the way whether it should be earmarked or whether it should be in the general fund, I think the most important thing, at least from a finance perspective, is that the health ministry should provide outcomes. They should push for synergy, integration.
I think Jane is waiting to
comprehensiveness. So if you come up with good outcomes, money begets money. If you produce results, you get more money. That's the paradox of finance.
Unfortunately, we've now run out of time. This is a subject which always can take up a whole conference in its own right. And I have very strong views about where the money should go, but I won't express those now. Can I firstly thank our panel very, very much. You've been excellent. Hopefully you've increased the understanding of the audience of the issues. And Minister Thacker, Under Secretary Paul, Ms. Jones, thank you very much for your contributions. I now hand the floor back.
Thank you.
Thank you all very much. As a practicing chest physician, I see the tragedies that smoking presents every day, and I've really become educated through the last several years by all of your work, but I especially like the line, money begets money. I hope that we can actually do that, translate that, but thank you very much. I just want to now move us to one of the very exciting parts of the Union's Week, and that's that throughout the week we get to celebrate and recognize individuals who have made outstanding contributions to TB control and lung health by presenting a number of the Union Awards. And it gives me great pleasure today to introduce the Princess Chichibu Memorial TB Global Award, and I'd like to welcome Dr. Shoji Kudo, the chairman of the Board of Directors of the Japanese Anti-Tuberculosis Association, to present this award, and this will be followed by the Atsuka Award.
Ladies and gentlemen, it is my honor and pleasure to be here today at this ceremony to give the Princess Chichibu Memorial TB Global Award on behalf of Her Imperial Highness Princess Akishino, patroness of Japan Anti-Tuberculosis Association. This award has been given every year since 1998 by Japan Anti-Tuberculosis Association in collaboration with Union at the World Conference of Lung Health in recognition of the distinguished achievement to international anti-tuberculosis activities. Please allow me to briefly introduce the background of this award. Her Her Imperial Highness, Princess Chichibu, had been the patroness of Japan Anti-Tuberculosis Association from its foundation in 1939. Shortly after she had started to serve as patroness, her husband, Prince Chichibu, a brother of the previous emperor, got TB and passed away after more than 10 years of struggle. After her husband's death, she devoted herself throughout her life to prevention of TB. This award was initiated based on her will to make the world free from TB. The winner of this award for 2015 is Professor Robert Peter Gee, Professor in Pediatrics and Child Health, Stellenbosch University and Tygerberg Children's Hospital, Cape Town, South Africa. He is a pediatric pulmonologist and intensive care specialist with a special interest in research and international policy in childhood tuberculosis. Professor Gee has been active driver in the process to get childhood tuberculosis acknowledged worldwide. He has stimulated and assisted many young doctors and students by teaching internationally on childhood TB and childhood pneumonia, especially in poorly resourced countries. I, on behalf of JATA and the Union, would like to invite Professor Gee to receive the award for his outstanding contribution to global TB control and prevention, especially in the area of childhood tuberculosis. Professor Gee, would you please come forward to accept your award? Congratulations.
Thank you very much.
My name is I.D. Rusin from the Union, and I have the pleasure to award the Young Innovator in TB Research Award, which is a joint award made by the Union and Otsuka. Unfortunately, the representative from Otsuka is unable to attend and has asked me to say a few words about the award. The Otsuka Young Innovator in TB Research Award was designed to stimulate new thinking and creative approaches to TB care, mirroring Otsuka's global commitment to TB innovation. We congratulate this year's winner, Dr. Gregory Fox, whose research in Vietnam as the country director of the Wilcock Institute of Medical Research in partnership with the Vietnam National TB Program has been instrumental in the development of new policies in TB screening and prevention. Identifying people at risk or living with active TB and helping them to access effective treatment is critical to addressing the challenge posed by MDR-TB. We hope his work will inspire others, fostering the next generation of great researchers in the field. Please help me welcome Dr. Fox to the stage.
Thank you all. This ends the plenary, and enjoy the rest of the day. I hope to see you in the halls. Thank you.